you will be learning in this module about the functional foods and their role in the disease, namely diabetes mellitus. You will be learning about the different categories of the disease, like the type 1 diabetes, the type 2 pregnancy induced diabetic condition, and so on. Diet is one of the most important lifestyle factor and cornerstone in managing this disease, along with of course the drugs, which is mandatory. The functional foods and the nutraceuticals have certain active chemical constituents that can be helpful in preventing the elevation in the blood sugar, which is the main problem associated with the disease, what the physicians refer to as the hyperglycemia. So, you will know how some of the foods can be of immense benefit to the diabetics by managing the increases in the blood sugar, modulating their lipid profile, and avoiding the complications that are associated with the diabetes due to mismanagement of the disease as well as due to its long duration. Diabetes is known to a common man as an abnormal increase in blood sugar. Broadly, these may be of type 1 or type 2. Type 1 is known as the juvenile diabetes, which occurs in young people, whereas the type 2 afflicts a normal individual during his adulthood and also known as adult onset diabetes. There is another type known as the gestational diabetes mellitus, which affects pregnant women, and the women generally become normal after delivery. Common symptoms associated with this disease are helpful in, first of all, diagnosing the disease are the polydipsia, increased thirst, increased frequency of micturition or polyuria, the increased appetite or polyphagia, getting tired very easily, and loss of weight very rapidly. Predisposing factors for type 1 are that it is mostly genetic based and immune mediated and require insulin administration. Diagnosis is often done in childhood itself. The type 2 is associated with increased carbohydrates content, intakes, obesity or overweight, stress, and lack of physical activity. Objectives of the management therefore are that mainly hyperglycemia or elevated sugar is the problem, and therefore this sugar increases have to be controlled mostly by the use of drugs. Following are essential to avoid the long-term complications. These are ideal body weight, maintaining a normal blood and urine sugar levels, maintain normal lipid profile, that is low cholesterol, LDL and triglycerides, and high amount of HDL or the high density cholesterol. Take proper food care, diet control to avoid macular and retinal changes in the eyes, good neurological status, micro and macro vascular complications. Diet and diabetes. Diet is the cornerstone in the management of this disease along with the drug therapy. We all know that diet will not reverse the chronic diseases, particularly kind of diabetic status, but it will have a good synergistic effect along with the drugs to prevent the increase in the blood sugar level. The diabetics therefore should eat a nutritious diet that should have moderate amount of carbohydrates, which are preferably complex type of carbohydrates, adequate protein, low in simple sugar, fat, salt, and lot of vegetables including green leafy vegetables. Glycemic index and load is two terminology that should be understood by anybody who wants to attempt in management of this disease. Foods that increase the blood sugar very high are high glycemic index food. Therefore, the sugar, sweets, etc., these are all high glycemic index foods, and foods which do not increase the blood sugar following their consumption are known as the low glycemic index food. Next, quantity that is consumed is also very important, and that is expressed as glycemic load. Ultimately, the elevation in the blood sugar level after consuming a meal is depending therefore on all these aspects, and very important aspect not related to the diet is the physical activity itself. That is also very important, and every diabetic should follow at least 20 to 30 minutes of simple exercise to keep himself fit. A diabetic person should also maintain a proper lipid profile to avoid cardiovascular disease, which is also a risk factor or a risk in the case of diabetes. That means the type of fat that a diabetic consumes is very important. He should essentially avoid the saturated fat and take fat that are monounsaturated and polyunsaturated. The food basically has got two things in that. One is categorized as a nutrient, the other one is categorized as a non-nutrient. So diet has both the nutrients and the non-nutrients. Now all the foods contain minerals, fibers, electrolytes, vitamins, amino acid, etc. Vitamins, minerals, etc. are important from physiological point of view, and their deficiency can result in deficiency condition, each having their own diseases. So these are the nutrients which are very, very essential, and they are also called as phytochemicals. The naturally occurring antioxidants in unprocessed fruits, vegetables, beans, legume, etc., they do not cause any deficiency conditions or diseases by taking less of that particular non-nutrient, but they have their own role to play in exerting a beneficial health effect. Role of the functional foods and nutraceuticals therefore in the diet is to provide a beneficial effect which extends beyond the nutritional properties that it possesses. Therefore, a diet which is diverse, it's not a monotone diet that we take, can be a source of both the nutrient and the non-nutrient. Now, there are different countries which regulate these nutrients and non-nutrient or the functional food, and they have their own definitions. According to the European Commission for Concerted Action on Functional Food Science in Europe, which is now called as FOSS, a food is regarded as a functional food if it has a proven beneficial health effect, and it should not be able to result in improved condition alone, but also reduce a disease risk besides its nutritional effects, and these effects must occur even if the functional foods are consumed at levels that are normally consumed at diet. So each nation have their definition. Now the difference between the functional food and nutraceutical is that the functional foods are consumed as part of the diet, and the nutraceuticals are ingested as pharmacological preparations in the form of pill, capsules, etc. Since these preparations are active principles present in the food, they are extracted, purified, made into pharmacological preparations, and their intake sometimes exceed the concentrations that are normally consumed through the diet. There are different types of functional foods. They are broadly classified into two, that is the conventional or the modified foods. Conventional foods are those in which the beneficial health promoting phytochemicals are naturally present, like the whole grains, nuts, soya bean, tomatoes, etc. That is, the whole food itself has some nutrients or non-nutrient both, which are of some benefit to boost good health status. But foods sometimes are modified by deleting or adding a new phytonutrient or removing something which is there. Milk is an example. For example, that can be fortified with vitamin D or extra calcium, and that is an example of a natural food that is being made into a modified food. All the fortified foods available in the market fall under this category. Whole grains are examples of the conventional functional food. Now the use of minor millets is gaining a lot of popularity, and they are being used to prevent or manage particularly the diabetic condition. Brown rice, wheat, minor millets like sorghum, bajra, are now therefore considered as functional foods, and their consumption in different forms is increasing. Now, when the whole grain is refined or milled, there is to some extent a loss of functionality, because we remove the outer part known as the bran, and the bran is rich in fiber, vitamins, particularly the B complex category, flavonoids, indoles, antioxidant minerals, and some small amount of proteins. The middle part of the cereal is the centrum stratum, and that's the endosperm, which is rich in starch and protein, but this doesn't have the micronutrient. The inner part is the embryo or the germ and contains high amount of lipids, proteins, minerals, vitamins of B complex category, phytosterol, antioxidant, and vitamin E. So by processing, what are we doing? We are crushing the cereals, separating the bran, the germ, etc., and making it as a refined grain flour. Now we lose the bran, which has got lot of these phytochemicals or phytonutrients. Now if the bran and the germ both are retained, then the flour is known as the whole grain flour, and this is definitely rich in phytonutrients. The fiber content of the refined flour is also reduced to 78% or less, and there is also substantial loss of minerals and vitamins. By refining, the concentrations of total polyphenols are also reduced. The absorption of fat and oil is inhibited by dietary fiber, and the absorption of carbohydrate is also modulated by dietary fiber. Since it is antagonistic to absorption of both fat and carbohydrate, it has beneficial effects both on lipid and glucostatus. Dietary fiber reduces the insulin resistance and decreases the intestinal transit time and facilitates the intestinal movement. Some categories of fiber support the growth of beneficial colonic bacteria. These bacteria carry out fermentation in colon and produce the short chain fatty acids, namely acetate, propionate, and butyrate. These molecules have the property of inhibiting chronic inflammation, colonic mucosa. The fiber content of the diet gives satiety and restricts the food intake. The restricted food intake as well as the lowered absorption of fat and carbohydrate helps in prevention of overweight and obesity, which are the two important risk factors for type 2 diabetes and cardiovascular disease. The probiotics and the prebiotics, which support the growth of probiotics, are considered now as functional foods. A mixture of both pre and probiotic is known as symbiotic, and that's also available as a functional food. The prebiotic is a component of food like the dietary fiber and encourages growth of bacteria, which produces secondary metabolites, vitamins, beneficial chemical compounds by fermentation. Most of the probiotics belong to the lactic acid bacteria family. Probiotic, prebiotic, and symbiotics are added to dairy products like milk, yogurt, and cheese, and daily consumption of these will be immensely beneficial. Since the prebiotics are mostly fiber, they increase the stool volume and helps in relieving constipation. They also help in absorption of some minerals like calcium, magnesium, zinc, iron, and produce B complex vitamins. Oats has high levels of beta-glucan, which is highly viscous soluble fiber. It reduces elevation of postprandial glucose due to consumption of the food. Therefore, it has beneficial effects on glucose metabolism. Soluble fibers increases satiety and slow the gastric emptying time. It slows absorption of glucose and hence has beneficial health effects to the diabetics. The beneficial effect is definitely due to the viscosity of this fiber. There are many cereal products that are fortified with dietary fiber, and they are helpful in controlling the increases in plasma glucose levels. Beta-glucan is the active ingredient or the viscous fiber that is present principally in oats and some other cereal products, and these are also added to some food products using extrusion technology. Excess intake of fiber, of course, can cause flatulence and render the food unpalatable. Therefore, food manufacturers cannot fortify foods with very high levels of fiber, and itself is nature of the fiber itself is a limiting factor for its use as a fortificant. Now, management of the CVD risk is important for the diabetics because they are at high risk of developing cardiovascular diseases, and their risk is 2 to 4 times higher than a normal individual without diabetes. In metabolic syndrome, usually more than one organ are affected. The diabetics also have a condition known as dyslipidemia or abnormal lipid status, that is, they have high levels of cholesterol and high levels of LDL cholesterol or the low density lipoproteins, the triglycerides which are elevated, and all these three are very strong factors for development of cardiovascular disease. Therefore, management of diabetic also involves management of lipid profile. Most of the diabetics are prescribed the cholesterol lowering drugs which are known as statins, as well as anti-inflammatory drugs in mild doses, namely mostly aspirin, which inhibit the platelet aggregation. This is done to lower the risk of CVD. Therefore, we understand cholesterol lowering by food component is going to be of use to these diabetics. There are a number of phytochemicals that are present in the food that can have positive effect on circulating levels of cholesterol. As per the recommendation of WHO and the National Cholesterol Education Program expert panel, it is better to limit the intakes of saturated fat and cholesterol containing foods and eat more amount of fiber containing diet. Fiber prevents the absorption of fat, particularly soluble fiber, which is present in cereals and legumes. These are also present in soy foods and nuts, and they compete with the cholesterol binding site in the intestine and thereby act as a competitive inhibitor. Some phytochemicals inhibit cholesterol synthesis as well. In view of the different metabolic pathways that are involved in lowering the cholesterol levels, it is prudent to consume a variety of food. Soy proteins inhibit the HMG-CoA reductase, which is the rate-limiting enzyme in cholesterol biosynthesis. Other functional foods that can be used by diabetics are the allium, both the garlic and the onion, which we consume every day in our diet. Garlic has many biological properties like antimicrobial, anti-inflammatory, hypoglycemic, hypocholesteromic. In experimental diabetic animal model using mice, rat, rabbit, garlic administration decreased the serum glucose levels. Garlic has many sulfur-containing phytochemicals that have strong antioxidant properties. In streptozotocin-induced diabetic rat, garlic oil diallyl trisulfide could show improvement in glycemic control. The antioxidant effects of S-allyl cysteine sulfoxide, which is a sulfur-containing chemical in garlic, has also been shown to be beneficial in diabetics. Whole garlic and other sulfur compounds present in garlic may have beneficial health effect in diabetes, therefore, and the mechanism of action may be by increasing the secretion of insulin by pancreas and beta cells, or release bound insulin, or it can function through both. The allium cepa bulbus is the onion that is taken by most of us, and it is also similar to garlic and has antimicrobial, anti-inflammatory, hypoglycemic, hypocholesteromic properties. Therefore, regular consumption of onion can be beneficial. It can also be effective to reduce some of the secondary complications like nephropathy, retinopathy, other neurological effects that occur in diabetics due to poor control of diabetic condition. Then we have the Trigonella phonicum or fenugreek. These seeds are used as condiment in Indian culinary for their flavor. This can be used by the diabetics, the leaves as well as the seed powder. The active principle in fenugreek is known as the trigonelline, and it has also a compound called saponin and another compound called diagenin, which and other alkaloids have plasma glucose lowering property. It has lot of soluble fiber that interferes with the glucose intake in the intestine. Fenugreek has been reported also to have anti-inflammatory property and can modulate enzymes that are associated with carbohydrate metabolism. Due to the soluble fiber content, there is reduction in gastric emptying, glucose absorption and insulin response. There was improvement in other clinical symptoms as well, like polydipsia, polyuria in many diabetic patients. An intake of about 25 grams of fenugreek seed can be immensely helpful in the management of diabetes. Then the commonly consumed spice, that is turmeric, known as botanically curcuma longa, is another important spice which is got curcumin as active principle. It has antibacterial, antiviral, hypoglycemic, hypolipidemic, anti-inflammatory properties and can have number of beneficial health effects in diabetics. The active principle of turmeric is curcumin and it has different mechanism of action. Then there is another spice known as cinnamon, and that is also used for its flavor by Indians as well as by others. This also has been shown to have anti-diabetic because of its antioxidant property, and the active principle is known as the eugenol in the case of cinnamon. Then guava fruits, which are rich in vitamin C, fiber, B-complex vitamins, also are helpful because of its soluble fiber content present, and it also can contribute to some levels of magnesium, which is known to be somewhat low in diabetics. Then there is pomegranate, which is also been used to treat the diabetes in China. It is used in the Chinese medical practice. It has got urusolic acid, which may be of benefit to the diabetics. Then we have the bitter gourd, which is botanically known as Mumordica charantia. This has been also shown to have some kind of beneficial effects in modulating the glucose levels in the plasma. The curry leaves or the Muraya koinji is another condiment that is used in the Southeast Asian country as well as India, and due to this chlorophyll content, it also may have anti-cancer, anti-mutagenic property, and it's useful to the diabetics. It has alkaloids like quinambine, quinine, quinangine, quinidine, mohaminimbine and mahaninin. These are some of the alkaloids that are present in the curry leaves. Then there is another vegetable which is eaten in India and other parts of Southeast Asia, that is the Coccinea indica, which is known as Kovakai in Tamil, Dondakai in Telugu, Kunduru in Hindi and Tindora in Gujarati, is an extremely and an extensively consumed vegetable, and the regular consumption of this vegetable may be helpful to treat the diabetics. Then there are cloves which are used as spice in India. This also has been shown to have some modulatory effect on increases in the blood glucose. The nuts, which contain principally the fats, are also beneficial because mostly they have the monounsaturated fatty acids. So regular consumption of nuts like almonds, walnuts may be of some help to the diabetics because they can regulate the glucose increases as well as the insulin homeostasis. Experimental studies using animals have shown that high amount of monounsaturated and low amount of polyunsaturated in proportion to the saturated fat improves the glucose homeostasis. Nuts also contain some amount of magnesium and fiber which reduce insulin resistance, and they are good source of other antioxidant vitamins and proteins. Due to their content of antioxidant, they also have antioxidant anti-inflammatory properties. Hence, consuming nuts or functional foods containing nuts can be helpful to prevent both the micro and the vascular complications in diabetes. So you have learned today in this module about what is known as diabetes type 1, which is the juvenile diabetes or congenital in nature. It's often diagnosed in children at the stage of infancy itself. The type 2 diabetes is also known as the adult onset diabetes and mostly diagnosed in the mid 40s and 50s, but now due to changes in the urbanization lifestyle, the age of onset has advanced. But these conditions can be managed by a judicious use of drugs, changing the lifestyle, as well as by taking some foods that are beneficial in avoiding the secondary complications of the disease, as well as in mitigating the hyperglycemia and other complications that may occur to the foot or to the nervous system, to the eye, etc. The nutraceuticals are the extracts that are prepared from the functional foods, and they fall in a gray area between food and drug, are also useful in the management of the disease.